MBCT stands for Mindfulness-Based Cognitive Therapy, which is of mindfulness meditation with cognitive therapy. Cognitive therapy is a very effective psychotherapy for depression, and the two of these together have been developed into an effective model to help patients that have recovered from depression stay well and to prevent relapse. The research on mindfulness-based cognitive therapy has been fascinating because we started with a very simple clinical question, which is, if you add mindfulness-based practices to psychotherapy, can you help patients look after themselves? Now, the real problem was that patients who were depressed often got better but didn't stay better for very long. And there was a real challenge, there continues to be a challenge, in helping patients prevent relapse and stay well. So to sort of hold on to the gains that they made in treatment for longer periods of time. And the initial question that we wanted to know really was what the rates of relapse would be for patients who practiced this form of mindfulness with cognitive therapy together. In our first studies, there were 2 published, an initial larger study of 200 patients and then a second replication study with about 74. In both of those studies, we found that mindfulness-based cognitive therapy reduced the rate of relapse by 50% for patients in our program compared to patients who were just receiving treatment as usual, which could have included taking an antidepressant or going to see a therapist. Now, since then, and possibly because of the initial success of our work, people have expanded the focus of MBCT to other populations, ones that we didn't necessarily start with, such as generalized anxiety disorder, patients with bipolar II disorder, and other applications such as eating disorders. The other piece which is really fascinating is the fact that there have been 2 or 3 studies of mindfulness that have used neuroimaging, so imaging of the way that the brain changes in response to people learning and incorporating mindfulness practices into their daily lives. Is that mindfulness seems to help people develop access to a different neural mode, one that in a sense silences much of the self-talk and the analysis and evaluation of feelings and thoughts, and instead allows people to also access information from the body and information from present moment experience. So people who are well versed in mindfulness, at least when it comes to working with their emotions, are able to draw on 2 different sources of wisdom, an internal wisdom that relates to where and how the body is feeling and the present moment of time, in addition to being able to watch their thoughts come and go. And both of these 2 together can provide important choices for how to react during emotionally challenging moments.